Good evening, everyone. I'm Jo Coombe. I'm the New South Wales Chief Veterinary Officer. Thank you for joining us this evening. Australia's first detections of H5 bird flu in migratory wild birds highlight the importance of preparedness across the veterinary profession. Vets are critical to early recognition of suspect cases, rapid reporting of emergency animal diseases, protecting animal health, public health and biodiversity, supporting confidence in Australia's biosecurity system. I thank you all for your ongoing commitment to protecting New South Wales. Now, before we start this evening, we do have a lot of content to get through in the next hour. So what we'll ask is that you submit questions through the Q&A function in Teams here, and we'll provide a written summary of those along with links to the recording and obviously any relevant resources out to you by the email that you've registered with by the end of this week. Now, next slide, please. Thanks, Don. I'd just first like to acknowledge the traditional owners of the lands on which we're meeting and pay my respects to elders past and present. And of course, I acknowledge that it's NAIDOC week this week as well. Next slide. Thanks, Don. I'm going to hand over now to Brendan Sharp, who's Deputy Chief Veterinary Officer in New South Wales. He'll talk through the current situation, a little bit about obviously the background around H5 and some measures that vets can take in terms of, their clinics and how they may take samples. He'll pass on then to another member of our team who will be speaking a little more about some more of the sampling, etc. And then also we've got someone here from New South Wales Health who will be talking about some of the zoonotic aspects of H5. So thanks, Brendan. I'll pass over to you now.
Thanks, Jo, and good evening, everyone. It's great to have such a strong turnout, which clearly this is a big issue for all of us. So in October of 2025, there was a detection of H5N1 bird flu on external Australian territories, so around Heard and McDonald Islands. This was discovered on work that the Australian Antarctic Division were doing. These islands were around about 4,000 kilometres off the west coast of Australia. We understand that the virus moved there and it tracked through South America, and though that was well publicised, the impacts on wildlife, both marine and on land, as it made its way down through there. So we understand that wildlife movements from that sub-Antarctic area to Australia are quite normal in the form of vagrant seabirds to Australia. These birds, we understand, are at sea normally, May through to August, as they chase food stocks before returning to their lands on the sub-Antarctic islands. So we are hearing reports that there potentially are more sightings of these seabirds around the Australian coastline this season for reasons that we probably can't comment on from an animal biosecurity perspective, but most likely due to marine conditions. So moving on from October of 2025, we come to the 20th of June in 2026 when Western Australia reported the first case of H5N1 bird flu. So that's H5N1 clade 2344B in a vagrant seabird. This was then followed up with a similar detection in South Australia. There have been multiple subsequent detections in WA, and we had our first detection on the mid-north coast region of New South Wales in a giant petrel. That was on the 2nd of July. So currently in Australia, we're looking at 7 confirmed cases, 5 in WA, noting that one of those is a presumed positive because the genomic sequencing wasn't completed fully just due to the nature of that sample. So that was 5 in WA, 1 in South Australia and 1 in New South Wales. So the Consultative Committee on Emergency Animal Diseases, which is the peak advisory committee in Australia when it comes to emergency animal disease and how we respond nationally, currently deems that this situation that we're in is an incident definition phase. And that is because we've only seen the virus in these vagrant seabirds. There's no indication of onward transmission to Australian wildlife on the continent. And the intent of the response activities that us and the other states and the Commonwealth is leading at this point in time is to enhance our surveillance to truly try and get a deeper understanding of whether there has been any onward transition to better inform our future activities and to allow us to put protections in place. And key to that, and key to the response activities, certainly in New South Wales, is enhancing that public information to promote that, to promote people's vigilance, to promote reporting, to allow us to gain that understanding. Importantly to note too that the virus detected on Bennett's Beach matches very well the viruses detected in South Australia and WA and is very similar to the viruses first detected on Heard and McDonald Islands. So they match that internationally regarded wildlife strain. It's important to note too that the strain that we have detected in these seabirds is genomically different to the strain that has been detected in the US dairy herds that virus has evolved to have a propensity to transmit mammal to mammal. We not that is not this virus. So Dom, next slide, please. So high pathogenicity avian influenza is nothing new to us. We've had multiple incursions in commercial poultry previously, the last one in New South Wales being in 2024. And these have all resulted from spillover of low pathogenicity avian influenza into poultry, and then it evolves into a high pathogenicity virus. We typically expect to see low pathogenicity avian influenza circulating through our wild bird populations, and our active surveillance confirms that year on year. Those low path strains have limited and have traditionally had limited impact on wildlife populations nor mammals. The difference here with the H5N1 2344B clade is that it is held in the wildlife populations in its high pathogenicity state. So it's causing clinical disease in these wildlife, and it means that there can be multiple point source crossovers to poultry in that high path form. So the risk is far greater from impacts on wildlife, from impacts on agriculture and food security. In a nutshell, that is the difference of the situation. Dom, if we could go to the next slide. So what does high path AI look like? We know from international reports that we often see individual or clustered dead birds or mammals as the first sign. What we found in the single bird from Hawk's Nest on the mid-north coast is it presented alive but quite moribund. Other signs that you might see with high pathogenicity avian influenza in avian species are quite variable, and they can include incoordination, head tremors, and similar neuro signs, unusual vocalizations, gastrointestinal signs in terms of diarrhea and regurgitation, respiratory signs, coughing, sneezing, swelling of the head, eye cloudiness, and oral and nasal discharge. Quite important to understand that these signs are by no means pathognomonic of avian influenza in avian species, and other diseases can present quite similarly. Next slide, please, Dom. And a video here, which we may not play in full, but it is a demonstration of some of the neurological presentations of avian influenza if the technology is on our side, which it looks like it is.
There is no sound with this video.
That might be okay, Dom. We might move on to the next slide in the interest of times. So HPAI viruses are shed in feces and respiratory secretions, meaning that the virus can spread through direct contact with infected animals or their feces, contaminated feed and water, and contaminated equipment and clothing. It's also understood it can travel short distances by air, and there's quite a bit of research going on internationally and in Australia as to the impact of aerosol transmission, particularly in and around poultry outbreaks, and we follow that research with great interest. The intent of any response activities would be to limit that risk where possible. Next slide, please, Dom. So our aims in responding to H5N1 detections in wildlife are to minimise the impacts of that on people's, animals and the environment. And the only way we can do that is by taking a One Health approach in our response activities. The response will focus on mitigation measures such as preventing of entry to livestock species through biosecurity controls, preventing spread to people through minimising contact with infected animals, and enhancing communications around that so people are well informed of their risk. In wildlife, if it does establish in wildlife on the continent, it would be typically considered that it will not be eradicable once established. And certainly we're seeing that globally as it can be maintained in wild bird populations. No culling of wildlife for disease control purposes will be undertaken. However, euthanasia of wildlife for welfare reasons it will be required on case-by-case basis. Obviously, should the virus get into commercial poultry flocks, culling of those flocks would be undertaken as per the nationally agreed policy set out in the AusVet Plan Manual for Avian Influenza, and the intent of that is to seek freedom for disease claim to support international trade purposes. Next slide, please, Dom. To assist private vets to manage the risk of H5 in their premises is the intent of this evening's presentation. So realistically, a collaborative effort across state governments, the ABA and Wildlife Health Australia and some private wildlife vets led to the publishing of some national guidelines to support vets in this space, and they were published last week and are available on a variety of media, including the ABA website. The intent of that work was to assist vets to reduce the risk of introducing H5 bird flu into their premises, to limit the potential for onward disease spread, and to provide advice on the management of suspected or confirmed cases of H5 bird flu. So later on in this presentation, we'll be taking you through some of the key components of that work. Next slide, please, Dom. So what is the vet's role during an H5 response? So vets obviously play a key role in any emergency animal disease response from a range of perspectives, including reporting suspect H5 bird flu cases through to state biosecurity agencies, supporting surveillance through clinical assessment and sample collection, providing trusted advice to clients on H5 or any other emergency animal disease, implementing enhanced infection prevention and biosecurity measures at the clinic level, and complying with any movement controls or biosecurity restrictions that are put in place as part of the overall response program. We'll jump to the next slide, please, Dom. So at this stage, I'm going to hand over to Janine Gagan. So Janine's a senior veterinary officer within the Animal Biosecurity Unit in New South Wales Department of Primary Industries and Regional Development. Janine's played a key role in our preparedness work within New South Wales, particularly at the crossover between domestic and wildlife settings, has been pivotal to the training of vets, but also biosecurity and wildlife officers in the field as part of our preparedness, and was involved in the development of these national guidelines. So thanks, Janine. I'll hand over to you now.
Thanks, Brendan, and good evening, everyone. So as Brendan mentioned, the guidelines for veterinarians have been released, and a lot of the information we are covering here really just points to that resource, and I encourage all vets to have a look at that guideline, make their staff familiar with it. And I'd also note that a lot of the content has been provided by wildlife hospitals and also from the Registry for Wildlife Health, who's based at Taronga, who already have these enhanced biosecurity measures in place and have already started planning quite some time ago for the arrival of H5 bird flu. And the resources were also provided in a range of online and face-to-face training sessions that we offered to vets in 2024 and 2025, and we've had a large number of people take up that opportunity for that training. And I'll note that the online version, the online module of that training is still available for anyone to do. You'll be able to find the link on the DPIRD H5 bird flu webpage. So preparing the clinic, we've got, obviously, first point is to develop a good clinic biosecurity plan that is suited to the facility you have and the staff you have. Prepare dedicated triage and isolation areas for animals that may be coming in that could potentially be infected with H5 bird flu. Train staff and develop standard operating procedures for how you will manage incoming birds that may or may not be infected or other wildlife. Ensure you have appropriate PPE on hand and appropriate cleaning and disinfection supplies, and make sure everyone knows how to use those items correctly. And if you're unable to effectively manage the risk at your clinic, depending on the facilities you have, establish a referral pathway early. And one example we have from a picture here is Currumbin Wildlife Sanctuary, who've already thought ahead and developed a triage centre, which is mobile and obviously can be used for triage of cases outside their actual clinic. Thanks, Dom. Next slide. Okay, another thing is to make sure you have enough PBGS. That's the viral transport media that is the most appropriate sample collection tube for collecting samples for H5 bird flu. The EMAI lab at Menangle, our state laboratory, has large numbers of the PBGS tubes on hand, and that's available to veterinarians that are likely to be submitting samples free of charge. So there's a website there where you can order that, the kits and the media and whatnot. And there's a fairly straightforward procedure for ordering those items. Just when you get onto that page, just make sure you scroll down and also request to please provide the sterile swabs that go along with those kits. The media and swabs will be sent directly to you, and we recommend that everyone has these PBGS and swabs on hand, ready to take samples if and when needed. And the PBGS can be stored in the freezer until needed, and then defrosted just before you take the samples. Thanks, Dom. Okay, so probably the most important first point to ensuring that you maintain biosecurity in your clinic is to encourage clients to call ahead before attending. And then it's most appropriate to do the triage outside the clinic where possible. And that allows the staff to do assessments over the phone and determine the safest management for a particular case. For example, the clinic may direct the client to wait outside and the animal could be examined outside, or, for example, in a mobile tent that Currumbin is likely to be setting up, and examine the animal outdoors. Then you can move the patient into an isolation room, depending on the outcomes of that initial assessment. Obviously, if the animal is, if it's a welfare situation and it needs to be euthanized, that animal can be euthanized out in the external area before, and then obviously doesn't come into the clinic at all. And it may also be appropriate to refer the case to another prepared facility if appropriate. And we anticipate that there'll be more and more clinics as they start to read through the guidelines. They start to look at the options they have at the clinic, and they may start to feel that they can do some appropriate triage at the clinic. So early triage significantly reduces the risk of exposing other patients, clients and staff to potential H5 bird flu. Thanks, Dom. So triaging is generally based on the premises and the patient risk factors. So the premises factors, you'd be looking at the client base and the location of your clinic. Obviously, if there have been a large number of detections of H5 in the area, then that would obviously alert you to the high risk risk factor for the clinic. And if you take or see a lot of wildlife and bird cases, then I guess you will obviously be slightly higher risk for bird flu. Whether you've got isolation facilities and whether you can set up some sort of makeshift isolation facilities at your clinic, maybe with an outer building or a garage that could be dedicated to isolation. And also consideration to the staff and business continuity. Obviously, I guess with more staff, you may be more capable of providing those isolation facilities. and also considering the referral arrangements in your area. So patient risk factors obviously include origin and exposure history. So if the person calls in and they're referring to a bird or an animal that has been located in an area where there has been cases already identified, high risk. Species susceptibility, we do know that those seabirds, water birds, wading birds are high risk, black swans, for example. So running through that list of susceptible species, and all that information is available in the vet guidelines. Clinical signs that you're seeing with that particular case that's been called in, any mortality events in the local area, and contact obviously with poultry or wild birds that could already be infected with bird flu. Thanks, Dom. So your triage outcomes will then be, I guess, determined there. And we've got a list of species risk, clinical signs risk, presentation risk, and concurrent signs. So just running through those signs that we've looked at previously, and those other risk factors that I mentioned in the previous slides. So following assessment, actions that you may take may include notifying the EAD hotline immediately if you do suspect H5 bird flu. You may then be able to admit the bird or the animal for further assessment into your isolation area, or you may choose in the particular case to refer the animal to another facility. And in a lot of cases, as we know, and as we've mentioned earlier, and as we've seen globally, any animals infected with H5 bird flu have a very poor prognosis, and in many cases, welfare-based euthanasia will be the most appropriate course of action. But it is also important to prepare for unexpected walk-in cases to the clinic, and we do know that some clinics are starting to put signage up which encourages people not to bring wildlife into the clinic, but to call ahead from outside, so that they're not at risk of bringing infected birds into the practice. Thanks, Dom. Okay, so reporting a suspected case, and we know that I guess most people online, or many online, would have already reported a potential case to the EAD hotline, whether it was bird flu or whether it's been any other unexpected or surprising illness or death in animals. So the sort of questions that you'll be asked when you call the hotline, and you need to be ready to answer, obviously the location, the species affected, species present. For bird flu, we're most likely, once we have further incursions, we're likely to see mixed species affected rather than just 10 lorikeets or 10 corellas, which is probably more likely to be a toxicity event. We'll be wanting to know the number of sick, dead and healthy animals in the area. Distribution of remains, has it been predated by birds or other birds or other wildlife? The condition of the carcass, how rotten it is, and clinical signs if you've been able to identify that. Extra information that you may be able to provide is if you have noticed if there's been sudden death or prolonged illness in the animals or the person that's reporting to you, sex and age, nutrition condition, recent changes in environment, food supplies and whatnot, and if you are aware of any endemic disease that could have been responsible for the deaths or the illness. And another big one that we do see reported to the hotline repeatedly are exposure to toxins such as pesticides, sprays and poisons. So if you're aware that the local council has been doing some spraying, or you know that local farmers have been using pesticides or fungicides on their crops, that's an indication that it might be more likely to be a toxic event. Thanks, Dom. So reporting a case, what to expect when you call the EAD hotline. So you'll speak to an officer, and DPIRD will advise you of further steps that you'll need to take. These may include attending, and I just want to point out that I'm aware that we have both clinic vets and also local land services vets and parks vets online tonight. So this information may be relevant to some of you, and another slide for others on the online here. So this may include attending the site if you're looking to look at wildlife in the field, and observing the number and types of birds affected, the location, clinical signs seen, and shown by any animals that are sick. Collecting, packaging and transporting samples from carcasses to the EMAI lab to test for HPAI, if directed by the New South Wales DPIRD hotline officer. You may be asked to collect carcasses for storage until a negative HPAI result is received, and then to facilitate further testing if requested by New South Wales EPA or DPIRD, and or safely dispose of carcasses where required. Thanks, Dom. Managing a case in the clinic, you'll be aiming to examine outdoors where practical, minimise contact with people and other animals, maximise ventilation where possible, use appropriate PPE, isolate suspect animals, contact EMAI customer service. They will provide a con note for samples to be couriered to the lab and details of the contact and the hours of operation there. Also important to contact the lab just to advise that a possible zoonotic sample is coming through, and certainly the hotline staff will help facilitate those contacts with the lab as well. Thanks, Dom. Responding to a suspect case in the field before responding. If you are likely to be doing some field surveillance, key areas to consider before responding to the suspect case. Consider the logistics and communications. Ensure you are clear about what you've been asked to do and where you are going to collect that sample. You must ensure you're authorised to enter the site. You should discuss the visit with the site owner or the manager or the person who's standing directly with the animals or observing the animals. Have access to relevant procedures, risk assessments and chemical safety data sheets for any compounds you may be using. You should pack with you your decontamination kit, sampling supplies, recording and packaging materials and your PPE kit. And the vets that have jumped in and done the face-to-face training that we offered in 2025, they would have received a little sample kit and those items. Next slide, thanks, Dom. Responding to a suspect case in the field, that decontamination kit, obviously the basic requirements of your decon kit, buckets to allow your mixing of your detergents and whatnot, paper towels, the brushes to wash down your boots and whatnot, antiseptic soap for good hand cleansing, disinfectant spray bottles to spray down your equipment, alcohol-based hand gel, which can be used in addition to correct hand washing, rubbish bags for bagging your materials, any disposable PPE materials, and potentially any carcasses that you're going to remove for disposal. Thanks, Dom. Next slide. So sampling kit, what's in the sampling kit? I've mentioned the PBGS viral transport media. So if you're swabbing a single animal, you'll need 2 of those PBGS tubes, one to take your oropharyngeal swabs and a second PBGS tube to collect your cloacal swabs. You'll need the sterile swabs to take those samples, scissors to cut off the long stem of the swab, an esky and ice brick to store the transport media and the swabs, and a permanent marker or a pencil or equipment to label the tubes. Next slide. Recording and packaging, you'll need this specimen advice form from EMAI, and there's a link to that one when you jump on the EMAI website and look for sample submissions for veterinarians. You need to take your camera and phone. It's really helpful to the hotline if we can see some photos or videos of the animals, the behaviour of the animals in the field, and any other aspects of the environment that might be helpful for triaging over the phone. You'll need to take plastic bags, as I mentioned, for double bagging any remains, packing tape and courier forms, appropriate specimen advice forms, and also disinfectant materials in a spray bottle. Next slide. PPE materials, and New South Wales Health will talk further to this point. The very basics would be latex and vinyl gloves, and obviously if you're likely to be dealing with a live animal, you'll also need some stronger protective gloves to avoid scratches and bites. You'll need a N95 or P2 grade face mask to protect from splashes from liquid materials, protective eyewear, protective coveralls, and rubber boots that you can wash clean after you finish your procedures. Next slide. So when to take samples, there is a range of appropriate to inappropriate samples listed there. Obviously, we don't want mummified samples sent to the lab. There's not really anything left to test in those ones. And the best samples in that table you can see there is class 1 to 3, so freshest, and then at the very most We want at least to be able to see that the organs are intact and recognisable. A little bit of bloating is fine, and you shouldn't be able to pull out the feathers or fur easily. That would mean it's too decomposed. So yeah, just but once again, if you can describe that to the hotline staff, they'll help you determine if you have any carcasses there that are suitable for sampling. Next slide. So we've got a little video here of there's the PBGS tube you can see there that you can order from EMAI, and a little bit of run through of that one. They're the swabs. So you just chop off the long stem and just a little cotton tip drops into the PBGS. So I'll just say at this point, if you're having to sample a large number of birds, you can pull up to 5 swabs from 5 birds from the oropharyngeal swabs into one tube, and in a separate tube you can pull up to 5 cloacal swabs from 5 different birds into one tube. So that will just save the PBGS tubes that you need to be using. Thanks, Dom. Thanks, Dom. How to manage submissions requiring multiple exclusions. Whole bird carcasses should not be submitted for HPAI exclusionary testing. So if you have a very high suspicion of HPAI infection, don't send the whole carcass. Where additional disease exclusions are needed that require a whole carcass submission, for example, if you want to exclude HPAI because you then may need to do toxicity testing, first you need to exclude HPAI through submission. So submit the swabs for HPAI exclusion first, double bag the carcass, disinfect the outside of the bag, and store chilled and well labelled in your fridge. Upon receiving a negative HPAI result from the laboratory, submit the bird for additional testing. And in most cases, the wildlife calls that we get, that additional testing, which could be toxicity, will go to the Australian Registry for Wildlife Health, and they work with EPA laboratory to test for toxicities and whatnot. Thank you. So just reiterate, just running over what we already saw in that video, your veterinary specimen advice form, and we've already had a bit of a look at how to fill out that form and the sort of information that is required. Next slide, please. So if you are looking to do an alternative diagnosis than HPAI, if you don't actually think that the animal died from HPAI, And this is for domestic birds such as commercial poultry, backyard poultry, pet birds, and aviary collections. If you don't think HPAI is your primary diagnosis, consider the following approaches to reaching an alternative diagnosis and excluding AI. You can either do postmortem in the field using appropriate biosecurity practices, collect first the tracheal and cloacal swabs for your PBGS sampling and additional postmortem samples from the organs that you want to test for submission to EMAI for AI exclusion and the additional microbiological testing and whatnot. Collect tracheal and cloacal swabs into PBGS and submit these swabs with whole birds to EMAI for full PM examination, AI exclusion plus additional testing. But once again, you'll be looking for advice from your hotline staff as to which samples to send in. On the submission form, make it clear that HPAI is not the primary differential diagnosis. Package swabs separate to the whole birds within a single submission, such as separate Ziploc bags within the one esky or the box. In these cases, standard charges will apply for additional testing other than HPAI and postmortems that are conducted at EMAI. For submissions to EMAI where HPAI is not the primary differential diagnosis, yet will include an AI exclusion, there is no requirement to notify emergency animal disease hotline ahead of making the submission. However, if we do have a large outbreak of HPAI and response circumstances could then change and the submission of whole birds to EMAI, but you'll be advised to the hotline for that situation. Next slide, thanks. So just running through the sample submission form, you're going to put your sample submission form into a plastic sleeve so as not to get that contaminated, and pop that on the top of the inside of your box, and some labelling that we've got there in the right hand side for EMAI for the sample receival team. Thanks. So key points to sample submission: all samples must be double bagged. You need your specimen containers in a leak-proof Ziploc bag, then double bag the specimens, and that goes into the outer box labelled with the sender details, receiver details. Disinfect the sample container as we saw in the video and place that inside the secondary bag. Disinfect the outside of the sealed secondary bag. Ship samples on ice or freeze them if they're unable to reach the lab within 48 hours. However, you certainly do want to avoid multiple freeze-thaw cycles, which can cause deterioration of the samples. We always advise never to ship samples on a Friday or before a public holiday because of the risk of the samples ending up in a courier depot and therefore deteriorating over several days. Next slide. Always contact a DPIRD EMAI specimen reception before sending the sample, and as I said, they can also help you with the con note. We usually use MetroState for sample couriers. However, the lab staff can work with you if MetroState don't service your local area, and there's some once again the address for sending samples to the EMAI state lab. Thank you. Safe carcass handling and disposal. Always minimise the risk of exposure when handling suspect bird cases. You and anyone else involved in the disposal must wear appropriate PPE and avoid direct contact with the carcasses. Use a no-touch technique where possible. Use tongs or a shovel or an inverted bag to collect the carcasses so you're not touching the carcasses. Double bag the carcasses in leak-proof bags and avoid contaminating the outside of the bag. Clean and disinfect your equipment and wash hands thoroughly after handling. Disposal of carcasses can be done via the general waste once they're double bagged, burial on your property where permitted, and or an EPA licensed landfill that accepts animal waste. Next slide, thanks. Decontamination disinfectant following any work with a suspect case. Always ensure cleaning and decontamination processes are effective for H5 bird flu, and we've had some guidance in that video. Avian influenza viruses are very susceptible to detergent, soaps, and many disinfectants. Effective disinfectants that are safe for equipment and surface disinfection around animals include Safe 4, F10, and Virkon. Prior to a disinfection, it's important that all organic matter is removed. Refer to the disinfectant safety data sheet for correct concentration, application method, contact time, and safety precautions. And further information is available in the AusVet Plan Decontamination Operations Manual that's available online. I've got a link there too. Next slide, thanks. Managing a suspect case in the clinic. Animals requiring submission should be managed to minimise risk of disease spread. Admit suspect cases directly to a dedicated isolation area where possible. Collect the samples you require promptly in consultation with New South Wales DPIRD EAD hotline staff for testing at the EMAI Government Laboratory. Maintain isolation and monitoring of the animal closely while awaiting HPAI test results. Consider the incubation period, which is up to 7 days in wild birds, when planning isolation and monitoring. Manage animals from the same event or location as a single isolation cohort where possible. And balance infection control with the welfare needs of the animal throughout isolation. And I'll just note that these procedures are already being followed by a number of vet clinics, particularly wildlife specialist clinics. Next slide, thanks. Euthanasia considerations. Make decisions based on individual animal welfare, as always. Follow existing wildlife care and rehabilitation decision-making processes. Ensure policies and procedures are documented for your clinic. Include euthanasia procedures in your H5 biosecurity risk management plan. And ensure appropriate PPE is available and staff are trained to use it properly. Next slide, thanks. If H5 bird flu is confirmed, what will happen next? New South Wales DPIRD will work with your clinic to manage the response. DPIRD staff member will contact you as soon as the result is confirmed. A case manager will be assigned as your primary point of contact. Risk assessment will determine the actions required for your premises. DPIRD will provide advice on biosecurity, patient management and business continuity. New South Wales Health will assess any potential human health exposures and provide guidance where required. Documented biosecurity plans and procedures will support a fast risk assessment and help your clinic return to business as usual as soon as possible. Next slide, thanks, Dom. And I'd just like to thank Registry for Wildlife Health, who put together that set of videos and arranged a set of 4 videos to assist clinicians with several aspects of these procedures, and they're available on the Registry for Wildlife Health website. I'll hand over to Kira Glasgow now from Health Protection New South Wales to talk about the human health considerations when handling wildlife. Thanks, Kira.
Thanks, Janine. Thanks also to Jen, who put these slides together for me. Jen's online as well, which is why her contact details are there. So we'll move on to the human health considerations for handling wildlife or other birds as well. Thanks, Dom. Okay, so who is at risk? And we're talking about from a human health perspective. So of course, it's generally people who are exposed directly to avian influenza in birds or in the environment. So people who either work with commercial poultry or in contact with sick birds, which is why we're talking to you right now as vets. Those who are in contact with sick other animal species that are susceptible to avian influenza viruses, and other people who you may not necessarily think are at risk, but New South Wales Health are thinking about, is those people who are travelling to countries overseas where avian influenza is present and they've got contact with those sick birds, or people who are otherwise in contact or have very close contact with the fluids of another person who's infected with avian influenza. So as we can see there, there's a group of visual images from the CDC Bird Flu Toolkit that you can have a look at and is relatively easy to read. Thanks, Dom. So how can you catch it? Pretty much all the ways that you can catch it. You can get it by touching an infected animal without PPE. You can touch it, it can come into your body through the mucous membranes. So if you touch the animal or the environment and then you touch your eyes, your nose or your mouth, you can breathe in droplets that contain the virus, or if the virus splashes into your eye or nose or mouth, which is why we recommend strongly wearing appropriate PPE. Thanks, Dom. Okay, so what can you do? I mean, avian influenza is an influenza A virus. They're pretty easy to kill, and most things that can kill them you can usually buy in the supermarket. So the very first thing is don't touch birds unless you have to, but you're all vets, so I don't think that's necessarily an option. But of course, your biosecurity plans are important. Wash your hands thoroughly and frequently with soap and running water. We don't recommend ethanol-based sanitizers, they are a little bit less effective than soap and water for avian influenza viruses. So definitely soap and water, and wear appropriate PPE, which I think from memory is on the next slide. And if you get symptoms, tell your doctor that you've been around birds because, of course, as an influenza A virus, there does need to be some additional subtyping to work out what we actually have in our people. Now, you will see the health messages also to get the seasonal flu vaccine every year. There's a couple of reasons for this. First of all, we do have to make it quite clear that this is not an H5 strain and the seasonal influenza vaccine, and it does not protect against avian influenza viruses, but it can, number one, prevent the risk of you getting infected with two types of influenza, namely being that we are heading into an influenza winter respiratory season. So we are seeing more influenza A, H1 and H3 in the environment. And it can also help reduce the risk of viral reassortment because, of course, we know that these influenza A viruses like to mutate, and that is one thing that we in health are trying to prevent. So really strongly recommend if you're working in the veterinary setting and you think that you might be handling one of these birds, please go and get your seasonal flu vaccine. Next slide, Dom. So what to do if you are in contact with avian influenza? We've just spoken about what would happen on the DPIRD front. And as they have said, in the very first instance, DPIRD will be your contact. DPIRD will let us know about it and we will get in touch. Our public health unit will get in touch and do an assessment. And there's several levels of assessment that we can do. None of them are requiring isolation at this point in time. The virus is not at a stage where it is very capable of human to human transmission. So this is certainly not something that we're planning to manage in any way, shape or form like COVID. But there is the chance that you'll be asked to monitor your symptoms for 10 days after contact. And that's what we've seen in the Hawk's Nest instance where those people are now coming up to 10 days. If you're well, you don't need to isolate, but at the same time, the public health unit might text you to see how you're going or give you a call daily, depending on whether your risk of exposure is assessed as low risk or higher risk, depending on your type of exposure that you had and how effective your PPE wearing was. Next slide, Dom. So your symptoms, as I said, it's an influenza A virus. It's pretty typical for flu. So you'd end up with a fever, and one or more of things like sore throat, cough, runny nose, difficulty breathing, headaches, diarrhea, nausea. In the US in particular, we did see a lot of conjunctivitis. Bearing in mind what Brendan said, that what we're seeing here is a genotype that's more closely related to the Heard Island strain and less closely related to the dairy cattle strain. So that sore eyes that we've seen is more affiliated with the US strain, which is quite important to remember. If you do develop symptoms, the very first thing to do, hopefully we have you on our list already as a contact, but if you think that you've been exposed to bird flu, please contact your doctor and indicate that you've been exposed to a sick bird, and make sure that you isolate yourself from others until you manage to see a doctor, and tell your employer if you are employed by a larger vet practice. You will be asked to, of course, maintain good hand hygiene in the meantime. The GP or whichever doctor you see would need to liaise with the public health unit to support testing. So we do not recommend that people attend their GP or their hospital without calling ahead, so that we can facilitate that testing. Now, what we haven't put in here is any indicators of the severity of avian influenza. And there's a really important point about that. I think most people would be looking at some of the news reports about the severity of H5N1 overseas. And what we know about the severity of H5 types is that they vary quite greatly between not only the clades, but also the genotypes within that clade. So the US type, within this clade that we are seeing, has quite a relatively low case fatality rate of around 2%. But that is, of course, again, not quite what we're seeing with the Heard Island strain. There have been no human cases of the genotype that has been seen in Australia. So we are are quite conscious that that can create some uncertainty, but at the same time, what we're seeing in those markers is that it's not very well adapted to mammalian transmission. So that is the good news. We, of course, are working with the labs and we're keeping an eye on that. But at this point in time, we are suspecting that it would be relatively mild. But of course, these estimates of case fatality rates are highly fluctuating and depend a lot on the individual exposed as well. So people who have suppressed immune systems might be more susceptible, or people who have higher exposure to high viral loads might be more susceptible. So the key message here is to make sure that you are wearing appropriate PPE at all times that you think that you are dealing with a case that could be avian influenza. I think that is on the next slide, Dom. Perhaps not. Now, of course, other wildlife health considerations to consider. We in health are making it very clear that at the moment you are far more likely to see other zoonotic conditions or be at risk of other zoonotic conditions. And the good news is that, of course, it's exactly the same things that you would do. So wear your PPE and use good hand hygiene, have good biosecurity measures in place, and then consider your other risk mitigations. Next slide. Mental health. We know mental health in the veterinary sector is a big thing. And certainly among the public, we're conscious that seeing high levels of mortality rates that are anticipated could be associated with high levels of mental distress. So there are things that you can do, such as calling the mental health line or having a look at some other mental health services that are available. So the earlier you can get support, the better. And of course, they still have the ability to have a mental health plan with your GP where you get cheaper access to psychological care. So strongly recommend that if you are working in this sector at this point in time. Donna, I will go next slide, but I don't actually think we have a slide on the PPE because I think it had already been covered by Janine. But I can just emphasize once again that what Janine has put up there is really appropriate. So the waterproof coveralls or disposable coveralls. The big thing is the P2 or the N95 mask and eye protection, as well as gloves and waterproof boots that you can wash off. So really make sure that you've got those things in place, which you really should have for a lot of zoonotic viral diseases available. And of course, there is all this additional information that you can seek out on various websites that contains a lot more information there. Thank you, Dom.
Thanks, Kira. I might just wrap up there. Firstly, I want to obviously thank Brendan, Janine and Kira for presenting tonight. There's a few links there, but we, as I said at the outset, we are recording this and we will send out the recording to everyone who registered. We had 1,000 registrants and I believe that may have caused some technical issues tonight. So firstly, I'm absolutely amazed and really grateful that many people, were interested in the webinar. As Brendan indicated, our confirmed case only occurred on Saturday. So we've turned this webinar around fairly quickly because we realised that people would be really keen to hear about what was going on. It's early days at this stage. We do only have these individual isolated cases, and we're very much hoping that will continue to be the case. But of course, we do intend to keep everyone updated, and if needs be, then we'll obviously run another one of these, and we'll try and ensure that any kind of technical issues are ironed out if we have an extremely large number of people registering. I've got to give a huge thank you to Dominique Marendi, who has organised all of this, as well as working tirelessly to keep the CVO unit running in our response. She's absolutely amazing. Yeah, thank you again for coming tonight. We'll send this out and yeah, by the end of the week, we'll aim to have answers to the questions that you've popped in the chat. So thanks for the engagement and we'll speak soon.